So to start us off is with Dr. Owen McGonigle, who is a orthopedic surgeon with Bluegrass Orthopedics. Welcome.
Thank you. Thanks for having me.
Thanks for doing it, and thanks for doing it in a little different format. I mentioned sports injuries. You all have a sports injury or walk-in clinic to take care of musculoskeletal injuries, correct?
Yeah, so this is something we've opened up over the last several months, where we're giving access all day long for people, really any type of injury or trauma, sports or otherwise, to have access to our orthopedic providers. Come in to get imaging, appropriate splinting or bracing as necessary, and then be referred on to the appropriate provider within our practice to help take care of whatever injury that we may be treating.
And now when you talk about injuries and kind of focus a little bit on sports injuries specifically, are there different types? Tell us a little bit about that.
Yeah, so obviously depending on which area of the body we're talking about might vary a little bit more. In the fall, we see with football, soccer, we tend to see a lot of lower extremity-based injuries, particularly around the knee or the ankle, and a lot of these tend to be traumatic, related to something that happened on the field or during practice, as well as some that may be more overuse related that come from training and preparing for a season or getting through a long season.
You mentioned overuse, but there are different risk factors that make you more likely to be injured, correct?
Well, certainly some are exposure risks, and so some of that's, if you play a certain sport, that it might put you at risk for that. But absolutely, if going into a season perhaps not ready or trained as far as getting into things too soon, potentially could put that at risk, both from a strength point of view or from just a pure stress point of view. We're talking about repetitive stress through the bones or through the soft tissues. Our body needs a time to adapt and heal. If we try to take on too much too soon, that's where sometimes we see injuries occur.
Now, specific injuries, we hear a lot about what they say ACL. What does that stand for, and is it really as common or devastating as we hear?
Sure, yeah. So it's anterior cruciate ligament, which is one of the main stabilizing ligaments of our knee, and it is one that's very commonly injured. And unfortunately, when we do have those injuries, they almost always require a surgical reconstruction in order to give stability back to the knee. Particularly in our younger athletes, that's not something that's going to be very well tolerated if they do suffer that injury. It does unfortunately come with a pretty long recovery process, a lot of rehab, a lot of time back. But the good news is, as long as we get through that, most people are able to return back to most of their activities at or near their functional level prior to the injury. So, it can be a very, very difficult diagnosis, but we do have some good treatment options.
Or are there some symptoms that make you worry, or you should worry and maybe see your doctor, maybe you have that injury?
Absolutely, yeah. So these generally, they're traumatic, and so this is not something that would gradually come on with time. Usually it's a very distinct event that would start that. These can be both contact or non-contact, and the non-contact variety is more common. Usually it's a twisting injury. Some people might describe a pop or a sense of the knee kind of going in and out of place. Usually most people aren't able to go back to participating in the sport that they're in or activity that they're in that day, and oftentimes will come with a very large swelling in the knee, or effusion is the word that we'll use. And so that usually develops over the first couple hours to the first day or two. And so usually it's a very big swollen knee that is hard to kind of move and walk on fairly quickly.
Well, that's great information. We appreciate you coming in. Again, appreciate the care that you give our patients.
Absolutely. Thanks for having me, and I hope you feel better.
Well, I hope so too. And again, thank you for doing a different scenario here. And for you out there, if you have a sports injury, they have a same-day walk-in clinic and a sports injury clinic at Bluegrass Orthopedics. We'll be right back.